Hi friends, I'm Dr. Neeta Rati from Vital Clinic, New Delhi, India. So we will be continuing our series on Bring Science to Beauty and the common problems which we come across in our practice on a day-to-day basis. Face lifting and neck lifting. So why is face lifting required or neck lifting required? Now what we see when we are young, our face skin is so tight, firm, and the neck is so firm that they are fitting well onto the bony structure. But as we age, plus in addition to if we are doing certain practices like too much of scrubbing or maybe facials or bleaching or whatever cosmetics we use on the face, over the time we see that now our skin is not as firm and it is gradually sagging. Now sagging can happen at multiple places. Number one, it could be like sagging of the eyebrows, or we can see certain lines on the face, or we can see certain lines because we frown, so these lines form on above the nose, or there are some lines on the crow's feet on the side of the eyes. The skin of the eyelid is now getting more folded. Under eyes, there is some amount of sinking present. There are some amount of lines present under the eyes, right? Or maybe the cheek fullness, the sign of youth is now not there. The skin is sagging. The jawline is now not as prominent as it was before. The neck will show certain horizontal lines, vertical lines, loose skin, folds. The collarbone is now not as firm or tightly visible as it was when we were young. So now all these changes when we see on the face, it gives a slightly aged look to the face and not too bright or that wow effect. So in that case, there is a need for face lifting or correcting of whatever damage has done on the face so that we get the same look as we had before and we miss that. So these now face lifting and neck lifting can be done in two different ways. Everyone knows that there are two ways. It could be a surgical way of correction or it could be a non-surgical way of correction. The surgical way of correction, of course, we do at Vital Clinic quite often, and this is done by under tumescent local anesthesia. That means we just give the local anesthesia on the face. So you can come, you can have breakfast at home, come at the clinic at 9:30. We do certain markings preparations, start the procedure, and maybe in 3 to 4 hours time, depending on how much damage is there, or whether we are doing only face, or whether we are doing only neck, or whether we are doing upper half of the face, or whichever area or how much correction is required. Say around, and as soon as the procedure is over, you can go home, have your lunch at home, and then maybe we call you after a week's time just for checkup. Now then, there is the non-surgical way which is gaining too much popularity over the time because there is no surgery involved and the results you start seeing from the day one, but it needs a certain amount of time and a certain protocol which has to be followed. So in face lifting and neck lifting, we give a 2-hour session of Reform CRF combined with Bell Block Home Kit, which is to be taken once a month, 3 times. That means a basic face lifting will need about 3 hours on the face and 3 hours on the neck to give you the best results. So a 2-hour session once a month, 3 times can give you the best results possible. So thank you friends. If you have any query regarding this subject, you can call us at Vital Clinic. The number is 26252333. I repeat the number 011 26252333. We are here to solve your problems in the best possible way, and all the procedures which are done here have no side effect, to the best of our knowledge, and to give you the best result in shortest of time. Thank you so much. Have a good day and bye-bye.